We now come to the general debate on epilepsy.
Thank you, Mr. Deputy Speaker. I'd like to start by thanking the Backbench Business Committee for offering and allowing my honourable friend, the member for Chesham Amersham, who has done so much to support and to advocate issues around epilepsy, and myself, the chance to secure this debate. Thank you. It's a great honour to be able to open also this debate with many members of the All-Party Group for Epilepsy, who over the last 5 years we have worked together to ensure that we've raised the issues around epilepsy with all the different departments that are relevant.
The World Health Organization launched a campaign on the 9th of Feb to improve the epilepsy treatment gap, and they urged member states to look at this, and they set out a number of clauses, and I'll just touch on a few: to ensure public awareness of and education about epilepsy, to integrate epilepsy management, to introduce and implement national healthcare plans of action for epilepsy management, and there are many more, and I urge honourable members to look at that. There have also been a number of important reports that have been released recently, and I'll touch on those in the speech. But I want to deal with the 3 different stages, Madam Deputy Speaker: young people, the transition from young person and adults to adult services. Turning to young people, the report Improving Epilepsy Care for Children and Young People that was published by Young Epilepsy, UCL and Whittington Health highlighted that there were unacceptable levels of misdiagnosis, inadequate communication, a variation in care and a fragmentation of services. There are 112,000 children and young people who have epilepsy. That's 1 in every 200 children. This report made 7 important recommendations, and I'll just touch on a few. Creating an individual plan for every child and young person. As one parent said, a one-size-fits-all is wrong. They want to design a year of care tariff for epilepsies, and they want to audit annual review of relevant outcomes for each child and young person. As Dr. Amit Bali, who was involved in the report, said, only small steps have been taken in areas that required big leap forwards.
Really timely that this debate has been called, and it gives everyone the chance to focus on this condition and what we need to do to improve the lives of those who have epilepsy. And I'm pleased also that the baton will be passed to the Honourable Member for Walsall South, who I'm sure will very ably continue to articulate the case for those people who suffer from epilepsy. The government is committed to securing high quality outcomes for people living with epilepsy in England, which is currently estimated to number over 450,000. There are many different types of epilepsy, seizures, and although some patients may have the condition from birth, others may become epileptic later in life. We know that for the majority of people with epilepsy, their condition can be well managed. The government recognises the importance of ensuring that patients with suspected epilepsy are diagnosed swiftly and accurately. As most people will be aware, seizures are the main symptom of the condition, and it's common practice for anyone who's experienced such seizures to be referred for assessment by a specialist. Neurological conditions such as epilepsy are part of the generalist undergraduate medical curriculum and are also a component of GP training. As such, GPs should be able to manage, monitor and appropriately refer the epileptic patients in their care. In secondary care, there are nearly 2,000 full-time equivalent neurologists, and for 2015-16, Health Education England has committed to invest in 217 neurological specialty training places. In addition, specialist epilepsy nurses should be a key element of both routine and specialist neurological care, as set out by NICE and NHS England respectively. To support clinicians in the management of this condition, the National Institute for Health and Care Excellence has published a guideline which sets out best practice on diagnosis, treatment and care of patients. The guideline recommends that referrals for patients with suspected epilepsy should be urgent, with patients being seen within 2 weeks. In addition, if seizures are not controlled or diagnosis is uncertain, people should be referred to a specialist service within 4 weeks. Most people with epilepsy can have their condition successfully controlled with anti-epileptic drugs. The NICE guideline makes clear that treatment should be individualised according to the seizure type, epilepsy syndrome, co-medication and lifestyle. For some people with more complex conditions whose epilepsy is more difficult to control, other procedures such as surgery or vagus nerve stimulation may be appropriate. Patients whose epilepsy is particularly difficult to treat may be referred to a specialist neurological care provider. In particular, children with epilepsy should be considered for specialised care at an early stage because of the developmental, behavioural or psychological effects that may be associated with suffering from continuing seizures. Madam Deputy Speaker, this has been an incredibly important debate, really important issues, and I will do everything I can to follow them up.
I want to thank everybody here, but ask the Minister to do something for everybody. Number one is talking with NHS England and working out how we can have a pathway to reduce by 400 unnecessary deaths that are caused by epilepsy, by SUDEP, every year. The second is to kick and beat the CCGs, the 90% of them who do not have a pathway. It is not acceptable. It is absolutely letting many people around this country down. And the third thing is, how are we going to implement and ensure that those NICE guidelines, that care, that long-term pathway of long-term chronic care is adhered to?
Order.